Welcome to Facts TV News, where everything is true. 3 men wanted in St. Catherine held or killed elsewhere over last 2 weeks. 3 men who were wanted in St. Catherine have been apprehended or neutralized following intensified operations by police personnel within the parish and other divisions within the past 2 weeks. One of the men has since been taken into police custody, another was fatally shot, while the other was shot and injured during confrontations with law enforcers in separate incidents. The men include 39-year-old Devon Campbell, otherwise called Yogi, of Garden Pen, St. Catherine. He was wanted for shooting and other gun-related offenses. He was held while boarding a plane in Montego Bay, St. James, and has been charged with shooting with intent and is awaiting other charges. 22-year-old Leonardo Leng, otherwise called Stoker, of Bronxwick Avenue, Spanish Town, St. Catherine, was shot dead in the Maxfield Avenue area of the corporate area. He was wanted for robbery and gun-related offenses. The other man was injured in the Colleyville area of Manchester. He was wanted in connection with several rapes in the St. Catherine North Police Division. His identity is being withheld as he awaits identification parades. The St. Catherine North Police, with the assistance of their quick response team, have committed to continue to increase their operational activities and multi-divisional partnership to apprehend criminals. Portmore man son charged with murder. 20-year-old Shamar Edwards of Greater Portmore in St. Catherine has been formally charged with the murder of his father, 52-year-old Dalbert Edwards, by the St. Catherine South Police. He is to appear in court on Tuesday. Edwards had been taken into custody on Monday evening following an alleged dispute with his father, during which the elder Edwards was stabbed. About 8:15 p.m., neighbors reported hearing screams of murder and ran to the house to inquire what was happening. They kicked open the door and found Dalbert Edwards lying on his kitchen floor in blood. They called the police, and Edwards, who was disabled, was taken to hospital where he died. His son, Shamar, who it was reported had come to live with his father only about a month before, was taken into custody in relation to the incident. Woman who retracted rape story charged with creating public mischief. The St. Anne woman who retracted her statement to the police that she was abducted and raped has been charged with creating public mischief. The identity of the accused has not been revealed by the police due to the circumstances of the case. The woman is expected to appear before the St. Anne Parish Court in April. Speaking at the St. Anne Municipal Corporation monthly meeting on Thursday, head of the parish police, Superintendent Dwight Powell, warned persons from attempting to make false reports to lawmen. Again, I'm going to say to the public that whenever they make reports to the police, they must be certain of where their headspace is or where they are going. Because when those reports are investigated and they are not proven, then there are other recourses that are left for law enforcement, police elaborated. St. Anne made national headlines across several radio stations, television, and online media entities after it was alleged that a serial rapist was on the loose in the parish. It was claimed that several women have been abducted by men traveling in motor cars and were later raped. In one case, a woman claimed that she was abducted in Ocho Rios and taken to Portland, where the hoodlums had sex with her without her consent in January. The woman reported the incident to the police, but she retracted her statement last month. Her retraction came sometime after her abduction and rape story was detailed in a voice note that has been circulated on social media, citing fear among women especially that a serial rapist was or a number of rapists were on the loose in the parish. A man had since been arrested and charged for at least one of the rape cases. He remains in police custody as investigations are ongoing. Fewer than 1% experience adverse effects of vaccine on day 1. The Ministry of Health and Wellness, MOHW, has revealed that 12 of the 2,718 people who received COVID-19 vaccinations across the island on Wednesday, fewer than 1% had adverse reactions to the jabs. Director of Family Health Services in the Ministry of Health and Wellness, Dr. Melody Ennis, said 6 of the 12 cases were in Kingston and St. Andrew, and 2 each in St. Catherine, Trelawney, and Westmoreland. Of the 2,700 plus patients we looked carefully at or observed just 12 for more than 15 minutes, and their outcome has certainly been good, and we are grateful for that, Ennis disclosed at the weekly virtual COVID-19 press conference. We are beginning to build our own database with the evidence that this vaccination that we are administering is indeed safe, she added. All 6 persons who responded adversely to the shot in Kingston and St. Andrew reported dizziness, with one also having nausea and another vomiting. In St. Catherine, one of the 2 persons experienced swelling and the other a rash. In Trelawney, both persons developed a rash, while one person in Westmoreland had dizziness. Ennis did not state the adverse effects of the other person in Westmoreland. According to her, all 12 individuals were able to depart the center safely after being observed, with the person who had swelling being treated with DPH. This, she said, is similar to what would have happened with someone who had an allergic reaction to eating a particular food. Meanwhile, Minister of Health and Wellness, Dr. Christopher Tufton, said the government is seeking to vaccinate 17,000 Jamaicans over the first week of the rollout as the effort to have herd immunity in the population is stepped up. Our aim in the next 7 days is to inoculate some 17,000 persons, continuing with our priority groups, healthcare workers first, and depending on how far we get in that group, then we move to the uniformed officers of the Jamaica Constabulary Force and the Jamaica Defense Force, which has already started, Tufton stated. According to Tufton, the vaccination process on Wednesday, the first day of the vaccine distribution, went smoothly, and he stated that he was pleased that the health authorities were able to vaccinate 83% of the first day's target of 3,280 across 39 sites. I think that's a good achievement. It's a commendable achievement given that this is the start of a national process and, in a sense, it was a trial run, if you will, and we really started in a manageable way to pick up any learning experiences, said Tufton. He added that the vaccination process will be tweaked based on learning experiences as it is being administered. Issues with AstraZeneca vaccine in Europe but not in region. The Caribbean Public Health Agency is aware that some countries in the European Union have suspended their AstraZeneca vaccination campaign as a result of reports of rare blood coagulation disorder in people who have had received the vaccine. It must be noted that the vaccine being used in the Caribbean is not the same version or batch as the one in Europe, a release from the Caribbean Public Health Agency stated. The release stated that the suspension in that version of vaccine was done as a precautionary measure while a full investigation is conducted into the reports. At present, it cannot be determined whether there is a link between the vaccination and the disorders. Adverse reactions that happen following immunization with any vaccine need to be fully investigated to rule out various factors, for example, concomitant illnesses, progression of a disease, and batch assessment before a final decision is made by the health authorities, the release stated. The World Health Organization's Global Advisory Committee on Vaccine Safety systematically reviews any vaccine safety signals and concerns related to COVID-19 vaccine safety. The committee is carefully assessing the current reports on the AstraZeneca vaccine. As soon as the WHO has gained a full understanding of these events, the findings and any changes to current recommendations will be immediately communicated to regional and international public health partners, which includes CARPHA. The World Health Organization states that vaccination against COVID-19 will not reduce deaths from other causes. Deaths from other causes will continue to occur, including after vaccination, but causally unrelated. As of the 9th of March, over 268 million doses of COVID-19 vaccines have been administered since the start of the pandemic, based on data reported to WHO by national governments. No cases of death have been found to have been caused by COVID-19 vaccines to date. We want to reassure our member states that CARPHA's Caribbean Regulatory System (CRS) applies its reliance procedure to verify vaccines with emergency use authorization granted by stringent regulatory authorities of reference. CARPHAs encourage persons who have been vaccinated with any of the COVID-19 vaccines available in their country to report adverse events that occur after vaccination to locate health authorities. The appearance of variants is part of the normal cycle of viral infections and replication and should not be considered an unusual process. Because the variants appear more frequently, the more subjects become infected. It is essential to maintain all the measures that prevent the occurrence of new infections, use of masks, washing hands, social distancing, and avoiding crowds. The appearance of new variants does not justify in any way the interruption of the vaccination campaigns against SARS-CoV-2. Cutting the transmission chains through preventative measures and the application of vaccines should be the primary objective at this stage of the pandemic. Both the measures mentioned above and the mass vaccination of the population will help in the fight against the disease and the eventual end of the pandemic. CARPHA remains committed to providing technical support and advice and continues to conduct tests for suspected COVID-19 cases for all CARPHA's member states CMS routinely as requested. So far, CARPHA has detected cases of the UK variant in several member states. No cases of the Brazil or South Africa variant have been detected. A release said CARPHA officials met with the region's chief medical officers to discuss several public health issues, including those related to the fight against COVID-19 disease. CARPHA continues to work with its region and international partners and CMS towards a harmonized regional response. The overarching goal is for all countries to control the pandemic by slowing down the transmission of disease and reducing mortality associated with COVID-19. In this regard, we urge countries to continue ramping up on their surveillance capacity to rapidly screen, identify, test, isolate, and trace contacts of new cases supported by public health prevention and control measures of social distancing, wearing of masks, and hand hygiene. We also recognize the important role for the vaccination program will play and are quite pleased with the efforts of the country so far in vaccinating the vulnerable older persons in their population and frontline workers. Government committed to tackling human trafficking. State Minister in the Ministry of Foreign Affairs and Foreign Trade, Senator Leslie Campbell, says the government is committed to ridding the country of the crime of human trafficking. Campbell, who was addressing a virtual Jamaica Diaspora Roundtable on Trafficking in Persons (TIP) on Thursday, said that considerable gains have already been made in tackling the issue. These include strengthening the legal framework to ensure that perpetrators of human trafficking are held accountable and survivors are compensated, protected, and reintegrated safely into society. We have established a national referral mechanism, which the work of the National Task Force Against Human Trafficking. We are strengthening Jamaicans' legislative, institutional, and operational capacity to combat TIP, Mr. Campbell said. He noted that the National Trafficking in Person policy provides a comprehensive framework within which the government can conceptualize, implement, monitor, and evaluate its action to eradicate human trafficking in Jamaica. Mr. Campbell said further that the government, through the National Task Force Against Human Trafficking and the Office of the National Rapporteur of Trafficking in Persons, is increasing public awareness about the crime and how persons can be recognized a possible victim. The State Minister noted that there is also a TIP manual for the Foreign Ministry staff and its high commissions, embassies, and consulates general, and sensitization sessions are held on an intermittent basis to enhance the knowledge and awareness of personnel about human trafficking. Mr. Campbell noted that the Diaspora Roundtable is an important part of the sensitization program. We hope that it will lead to a collaboration with the government to assist our fellow citizens in overseas territories who may be unfortunate enough to get caught in the TIP trap, he added. The session was moderated by Chair, Global People Work Group and Global Jamaica Diaspora Council Northeast USA Representative Dr. Corinne Dunkley and Chair, Prevention Committee of the National Task Force Against Human Trafficking, Audrey Bodai. Participation included members of the National Task Force Against Human Trafficking, the Global Jamaica Diaspora Council, and the Jamaican Diaspora Community. Health Ministry will monitor persons who have been vaccinated. The Ministry of Health and Wellness will monitor persons who have been inoculated with the COVID-19 vaccines to determine whether there are any adverse reactions. On Monday, March 8, Jamaica received its first 50,000 doses of the AstraZeneca vaccine donated by the government of India. The country started administering the vaccine on March 10, exactly 1 year after the first case of the virus was confirmed on the island. Addressing the weekly COVID conversation virtual press conference on March 11, Portfolio Minister Dr. Christopher Tufton said the government will be moving forward with administering the AstraZeneca vaccine as it has been deemed effective by the World Health Organization (WHO). He said only vaccines that have been approved by the WHO will be given to Jamaicans. The vaccine has been administered to millions of persons so far around the world, and we have not had incidents that could change the expert view that it is an effective and safe vaccine. We will track the persons here in Jamaica who will receive the vaccine, as we have done to show the actual impact, and so far so good, he said. The AstraZeneca vaccine is on the World Health Organization's emergency use listing, which assesses the quality, safety, and efficacy of COVID-19 vaccines and is a prerequisite for COVAX facility vaccine supply. It also allows countries to expedite their own regulatory approval to improve and administer COVID-19 vaccines. 4 more die from COVID-19 while 525 test positive. And additional 4 COVID-19 related deaths and 525 new cases were recorded across Jamaica on Friday, according to the Ministry of Health and Wellness. The deceased are a 54-year-old male from St. Catherine, a 56-year-old male, and 2 95-year-old males from Kingston and St. Andrew addresses. The latest fatalities bring the death toll from the coronavirus in Jamaica to 484. Of note, the death of a COVID-19 patient was classified as coincidental, while another death is under investigation. The 525 newly confirmed COVID-19 cases bring the total number of cases on record for the island to 29,912. Recoveries increased by 147, bringing total recoveries to 15,059. Of the newly confirmed cases, 295 are females and 220 are males, while sex of 12 persons are under investigation. The ages of the positive individuals ranges from 20 days to 90 years. The cases were recorded in Kingston and St. Andrew, 129, St. Catherine 74, Portland 65, Hanover 45, Trelawney 38, Westmoreland 37, St. Anne 35, St. Thomas 31, St. Mary 24, St. James 19, Clarendon 19, St. Elizabeth 5, and Manchester 4. There are 24 moderately ill patients and 33 critical ill patients among the 13,939 active cases now under observation in Jamaica. Please remember to subscribe, like, share, and click the notification bell for daily updates.